today is World Malaria Day, and so caregivers in the Ketu North and Akatsi North districts of the Volta region are preventing their children from taking part in the ongoing pilot implementation of the malaria vaccine. According to health officials in these areas, the refusal of parents is as a result of misconceptions relating to the COVID-19 pandemic. This report was filed by GH1 News' Faisal Abdul-Idris.
More than 40,000 deaths are attributed to malaria each year, with African children being the highest casualties of malaria deaths. In 2019, malaria accounted for more than 265,000 deaths of children in Africa. In a bid to curb the ravaging effects of the disease, the World Health Organization in 2016 recommended the pilot implementation of the malaria vaccine RTS S 01 to further evaluate its public health use as a complementary malaria control tool that could be added to the core package of existing preventive, diagnostic and treatment measures it had earlier recommended. The RTS S 01 is the first and only vaccine to have shown a partial form of protection against malaria in young children. The Ministries of Health in Ghana, Kenya and Malawi, through their national immunization programs, have been leading the phased implementation of the malaria vaccine in selected areas since 2019. In Ghana, the vaccine is being provided through the routine system in 42 districts in 7 regions across the country. The smooth implementation exercise has, however, been hard hit in recent times due to misconceptions relating to the COVID-19 pandemic, among many other challenges. According to the Ketu North Disease Control Officer, Christopher Kakwetinge, the outbreak of the COVID-19 pandemic has brought some level of hesitance among parents, some of whom are now unwilling to allow their children to take up the vaccine.
It's a challenge, not just only malaria, but generally it has affected other service delivery. People actually are hesitant to visit the health facilities for care for the fear of contracting the virus. Others also have the perception that some medications given to them at the facilities are medications that can transmit the virus to them. So they have been hesitant going to the facility. With the doses, there was a time staff go for outreaches to give vaccination. And people felt like because there was COVID in the system, the Ghana Health Service has smuggled COVID vaccine into the system to give to their children. They waited, their mothers never came out with their children. And so that has been a challenge as at now.
Sandra Abowu is a nurse at the Devego Health Center. She is in charge of the vaccination team here. She explains why parents are not taking the vaccines in her area.
Right now, people are saying the RTS S is the COVID-19 vaccine. So they are not willing to take it. But we are still talking to them to accept it, since they have taken the first, second, and then the third one. Because if you didn't take the fourth one, that means you are not fully dosed, and then malaria can deal with you with that. So we are trying our best to complete it with them.
In the Akatsi North District, the situation is the same. According to the District Director of Health, they are unable to meet set vaccination targets due to the effects of the pandemic.
We were insisting community members adhere to has affected us. So caregivers were scared. They were not bringing their children for immunization services because we said we should stay at home, we should maintain social distance and other protocols. So, and then that fear that when you go to the health facility, you are likely, there's a likelihood that you'll be suspected as a COVID client was very high. So people were afraid to come out.
Aside from the COVID-19 misconceptions, the malaria vaccination campaign has been bedeviled with some other challenges.
People have the perception that they have been born for several years, they've never taken some vaccines, and they are healthy. So they felt like their children should never be vaccinated. Some think their gods have power or supernatural powers to protect the children. And those are all challenges we are facing. We've been able to counter some we haven't still been able. Regardless of several engagement, people still refuse. That notwithstanding, I think patronage hasn't been so bad. We've been doing so well.
Evans Kwame Foley A nurse at the Ghana Mission Hospital at Joje in the Ketu North Municipality told the news team that some parents are not allowing their children to take up the vaccine because they believe that the children are just being subjected to too many immunizations and vaccinations.
The pressing challenge currently is the compliance of parents. They always complain the immunizations are too much because they don't see the reason why they would take Penta 1 at 6 weeks, Penta 2 at 10, and Penta 3 at 40. Then in 3 months, they will still come for the RTS S. So sometimes it's like whenever they see us, they begin to hide. They don't see the reason why they should present the chart for all these vaccines. Yes. So sometimes we also try to educate them on the importance of the vaccination, the reason why they must take it.
In the Akatsi North area, the campaign is also faced with the challenge of accessibility, as 80% of the district are hard to reach rural communities.
Of our communities that we serve are rural communities. We have about 80%, or let me say 90% of our communities are very hard to reach. There are no tarred roads connecting them. Some are just footpaths, some are just farm roads that we ply with motorbike. And then when it rains, it becomes difficult. Caregivers coming down to the facility or health staffs, especially community health nurses, connecting the communities.
As a result, in the Ketu North Municipality, for instance, the 2020 figures for children who took RTS S1 stood at 2,723, but dropped minimally to 2,633 for RTS. For RTS2, while dropping further to 2,445 for RTS S3 in the same year. In Ghana and Kenya, eligible children received the vaccine from the ages of 6 months, with a final dose given around 24 months of age. Despite the challenges, it is expected that by World Malaria Day on 25th April, which coincides with African Vaccination Week, more than 1.7 million doses of RTS S will have been administered by the Ministries of Health in Ghana, Kenya and Malawi, with more than 600,000 young children expected to have received a first dose of the vaccine. In Ghana, more than 680,000 doses of the malaria vaccine would have been administered, with more than 230,000 children receiving the first dose by the end of April.
So today being World Malaria Day, we're asking what you make of Ghana's fight against malaria. And Fritz Delanya Megashi is standing by with all your thoughts and comments on social media. Hi, Fritz. Good evening.
Hi, Lily. Thank you very much for joining us on the social media segment. And of course, we're engaging on today's Malaria Day. And we have a question for you, as Lily has already run by you. Now, let's go on to Facebook, of course, where we have a thread of those messages coming through for you. And we'll start off with Azan GHA said, I'll rate Ghana's fight against malaria 35% because if you visit our hospital today, all cases recorded per day are about 70% and above our malaria cases. Well, that's according to you. We'll cross-check the figures. Now, Peter also said, too much to do, so little done. And Nana Kwejo Liga said, 19%, you should back up. And Edu was a very funny one here. I'll not be able to read that. Now, quickly, let's dash to Twitter and find out exactly what people are saying there too. And he said, no be choco here. So trying to say that, well, if it comes to choco, the cases there are too much. So certainly not in choco. And Sika said, open dirty gutters, mosquito breeding sites, people using mosquito nets for fishing. Well, we've done some reports that have suggested that people are using the mosquito nets to fish instead of using them to sleep. Advertisement saying mosquito repellents smell good. Exciting is like perfumes, while harmful to the human body. And you think it is going on? Well, it was a question we asked. And Mr. Lameng said, we the citizens do nothing to help fight this. For the government, it's another story. And so that would be the comments on Facebook and, of course, Twitter. But let me throw it back to you, Lily. Lily, what do you make about the country's fight against malaria?
Well, I think we're still in the teething stage. We're still getting there. But you know that because of the COVID-19 pandemic, we have shifted focus from all other diseases and ailments, and we're focusing on COVID-19. So if attention is given to every other disease, I'm sure that we'll get there with our fight against every other disease, not just malaria.
All right. Thank you very much. It's always been a pleasure coming to you on social media segment. Go on our Facebook page, Twitter, and of course, Instagram, and keep interacting with us. My name is Fred Delanya Megashi. And over to you. Let's continue with the rest of the bulletin.
Thank you very much for